Every day, millions of people around the world visit a healthcare facility. The care and handling of patient care instruments used to treat patients is vital to their health outcome, and there is no room for error. However, healthcare-associated infection, HCAIs, are now a global concern. HCAIs result in prolonged hospital stays. HCAIs can have a devastating impact on patients' lives. HCAIs are an enormous drain on healthcare budgets. According to WHO, of every 100 hospitalized patients at any given time, 15 in developing countries will acquire at least one HAI. A report from Indian Journal of Basic and Applied Medical Research states that the overall incidence rate of surgical site infections, SSIS, in India varies from 2 to 21%. Inadequate sterilization of instruments is one of the key operation characteristics that may influence the risk of surgical site infection development. Good infection prevention and control programs can reduce healthcare infections by 70%. And can effectively control several impacts on the overall healthcare setup, including reduced hospital stays. Earl H. Spaulding devised a rational approach to disinfection and sterilization of patient care items and equipment. Spaulding believed the nature of disinfection could be understood readily if instruments and items for patient care were categorized as critical, semi-critical, and non-critical according to the degree of risk for infection involved in use of the items. A 1991 study expanded the Spaulding scheme by dividing the non-critical environmental surfaces into housekeeping surfaces and medical equipment surfaces. The classes of disinfectants used on housekeeping and medical equipment surfaces can be similar. However, the frequency of decontaminating can vary. Stay tuned to know more on Spaulding's classification.